We owe it to our furry friends to give them a safe living environment. One way to do that is by keeping medications out of our pets' reach. FDA has received reports of deadly pet poisonings related to a common human medication, topical Fluorouracil, also known as 5-FU. Some of the brand names include Effudex, Carac, Tolac, and Fluoroplex. I'm Dr. Linda Walter-Grimm, and this is Max. I'm a veterinarian at the Food and Drug Administration, and I'd like to talk to you today about pet safety. Nearly 75% of U.S. households have pets. Pets encourage us to get outside, exercise, and socialize, helping us live healthier lifestyles. Pets can also help manage loneliness and depression by giving us companionship. Topical Fluorouracil products are important medications prescribed by doctors to treat a wide variety of cancers and skin conditions in people. However, Fluorouracil products are extremely toxic to our dogs and cats when ingested. The most common ways accidental Fluorouracil poisonings happen in dogs and cats is when a pet bites into the tube of Fluorouracil or licks its owner's skin where the medication was applied. Fluorouracil is rapidly absorbed by the pet's digestive system, and even tiny amounts are very toxic and can result in severe reactions, including death. If you think your dog or cat has chewed on a Fluorouracil container or was somehow exposed to the medication, minutes matter. Contact your veterinarian immediately. Fluorouracil poisoning symptoms include vomiting, drooling, shaking, seizures, difficulty breathing, and diarrhea. These symptoms are often seen within 30 minutes, but can appear up to 6 hours later. And death can happen in as little as 6 to 12 hours after a pet is exposed to Fluorouracil. I can't stress this enough. The fatality rate is almost 100% if your pet doesn't receive immediate treatment for Fluorouracil poisoning. Taking proactive measures is the best defense against accidentally exposing your dog or cat to topical Fluorouracil products. Store the container in a closed cabinet or on a shelf your pet cannot reach. Apply the medication away from pets. Make sure you use a room or bathroom where you can close the door so your pet can't get at the medication while you have it out. Talk with your healthcare provider about covering treated skin to prevent your pet from licking it. And if you can't cover the treated area, consider keeping your pet separated from you until it's safe to wash the treated skin. Keeping the Fluorouracil container on top of a nightstand or a countertop may help remind you to apply the medication, but it also provides easy access to curious dogs and cats. Throwing empty or unused medication containers into an open trash can is also a big temptation to your pet. Securely dispose of empty or unused medication containers. Ask your doctor or pharmacist for advice if you are unsure how to dispose of the container or the medication. Immediately contact your veterinarian or local emergency veterinary hospital if you think your pet has been accidentally exposed to Fluorouracil medication. These are some key things you'll need to know when talking to your veterinarian or animal poison control center. The weight and size of your pet, the Fluorouracil strength and amount your pet was exposed to, the approximate time you believe your pet was exposed, a list of any symptoms your pet has, a description of your pet's general overall health, and a list of pre-existing conditions and medication your pet takes. You or your veterinarian can report your pet's side effects following exposure to 5-FU or other medication to FDA. Visit our FDA webpage for information about how to send us a report. And for more helpful tips, visit FDA's webpage for pet owners on how to safely store medications, and our medication error webpage. That has tips for how to avoid accidental medication exposures in pets.